Now, CNN held a town hall last night to discuss the Obamacare replacement bill that is currently being proposed by the Republicans. Now, among replacing subsidies with tax credits and raising premiums on the elderly, one of the provisions inside of this piece of legislation also defunds Planned Parenthood. Well, that's crazy, right? This is supposed to be a health care bill, and it defunds Planned Parenthood, which helps out millions of people. Well, it's crazy. Now, during this town hall, a New York resident named Katie Needle illustrated why cutting Planned Parenthood would be actually incredibly disastrous for women. Let's take a look at this.
Planned Parenthood provides an array of vital health services for women, and the majority of their patients are on Medicaid. I'm a Medicaid enrollee, and I'm a Planned Parenthood patient, and I would be absolutely devastated if Planned Parenthood were defunded. We've already seen in Texas that cutting access to Planned Parenthood means women have less access to health care. More women's health centers didn't just magically appear because Planned Parenthood was defunded. That just doesn't happen. And I just want to call back, this wasn't part of my question, but I just want to call back because you earlier brought up Medicaid specifically and complained about how one of the biggest problems under Obamacare was that only a third of doctors were accepting Medicaid. This plan chooses to cut a provider that sees over a million Medicaid patients every year. So if that is your big problem with Obamacare, then how does that make any sense? That's not my question.
Does that make any sense? No, it doesn't make any sense. Unless you're against women getting health care. And by the way, Planned Parenthood doesn't just benefit women, it benefits men too. Men can go to Planned Parenthood as well. Because they also do things like free contraception and stuff like that. In fact, a Guttmacher report found that among women who receive care from a family planning center like Planned Parenthood, nearly 4 in 10 report that it is their only source of health care. Now, being a dude, I never knew that. I never knew. And I never knew exactly what Planned Parenthood did. So reading into this, obviously I found out like, hey, wow, they actually do a lot of services for women that you don't get at places like community health centers. And so, for example, you have preventative health care screenings, well woman exams, breast and cervical cancer screenings, vaccination, and of course what they're known for is birth control. Now, not only that, but they help people who are poor. In 2013, 78% of Planned Parenthood patients had incomes at or below 150% of the federal poverty level, and half of Planned Parenthood patients are covered through Medicaid, as Ms. Needle pointed out. Something else that Price and Ryan Care, or Trump Care, whatever you want to call it, are actually looking to get rid of. Now, she also talked about what happened in Texas. Well, what did happen in Texas? Well, in 2011, the state cut its family planning budget by 2/3 and banned Planned Parenthood from participating in the state's women's health program. Now, before this, Planned Parenthood served about 50% of the women's program's patients. By 2013, the number of women who received care through the women's health program had dropped by more than 50%. So 50% were served when they were funded. Oh, they get defunded. Now those 50% are no longer served. Well, that's what happens. Half of all women depended on Planned Parenthood, and guess what? Nothing took its place. Nothing. These, again, as she said, these health centers didn't magically pop up out of nowhere. It's community health centers. No, it takes a while to set these things up. So there are women out there now in Texas that have no care. Well, that's the opposite of what you say you're trying to do. And look, community health centers out there, by the way, they're looking at this bill and they're saying, whoa, wait a minute. Oh, hold on here. We do depend on Medicaid. In fact, a lot of our patients, a lot of our new patients, since the ACA was passed, have come to us. We have been helped greatly by the ACA. Don't get rid of it now. No, don't. Don't eliminate Planned Parenthood. And we do two different things. Community health centers are more generalized, and of course, Planned Parenthood is more specialized. That's why it's important. Now, Katie is going to continue, and she actually is going to ask her question to Price, and then he's going to respond. Let's take a look at that.
How do you expect the millions of low-income women nationwide who depend on Planned Parenthood for these vital human services, basic needs, to access these things if Planned Parenthood is defunded?
Yeah, this is an important question because the fact of the matter is that the American people have for decades said that they didn't want their tax dollars, their federal tax dollars, to be used for the provision of abortion services. And so what we have tried to do when I was in Congress and now with administration is to respond to the desires of the American people in a way that answers their concerns. The fact of the matter is that what the bill does that is before Congress right now actually increases money for women's health services. And we do so by providing those monies through community health centers. There are over 13,000, if my number's correct, over 13,000 community health centers across this country, and they're in the hundreds of Planned Parenthood facilities. So what we're trying to do is respond to the American people and their concerns about having their tax dollars, federal tax dollars, used for the provision of abortion services, and make certain that women not only have more ability to get to a health center, but have more resources to be able to do so.
Well, wait a minute. That doesn't make any sense. How does defunding Planned Parenthood and then shifting that same amount of money over to community health centers cause an increase in women's health care? You've just shifted that money. It's the same amount of money. They're not allocating any more funds towards women's health care. They're just shifting it around and claiming, oh, look, suddenly we got more money for women's health care. No, that's bullshit. That's the problem here. You know what else is bullshit? You have them saying, well, look, hey, people don't want their tax money going to abortion. Well, good news, it doesn't. No federal money goes to abortions unless it's in extreme circumstances. For example, the life and health of the mother. See, there's something that we have since the 1970s called the Hyde Amendment. The Hyde Amendment says no federal money can be used for abortion. None. And you know what? No federal money gets used for abortion. That's the thing. But see here, it's not really about abortion, all right? Republicans despise Planned Parenthood because what it does is that it actually advocates for women. And it helps the poor. It helps minority women, for example. And look, 3%, yes, what they do, 3% of what they do are abortions, right? But remember, abortion is still legal in America, and no federal money goes towards funding those abortions. Your tax money does not fund those. But again, Republicans don't give a shit because they see Planned Parenthood out there actively defending women's reproductive rights. And they can't stand that. There's a complete hypocrisy on this. Now, women, of course, like Katie, well, they see what the Republicans are about. They see the bullshit that this guy is spreading. And what they're saying is, not on my watch. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.